welcome to the Stronger After Stroke podcast. I'm your host, Rosa Hart, stroke nurse navigator at the Norton Neuroscience Institute Resource Center. And today we get to speak with a caregiver, and this is Michelle Sanchez. Welcome, and thank you for joining us today.
Thank you for having me, Rosa.
So, stroke is a brain injury, and with that comes a lot of changes. And Michelle has done so much to not only help her mom, but take what she's learned from learning to care for and advocate for her mom to share with others in the community as well. And so I'm really excited to give you the opportunity to hear her story and some of the takeaways she has from their health journey. So, Michelle, first of all, could you describe for us what life was like before your mom's brain injury?
Certainly. My mom was in her early 70s. She was fully independent, retired, looking forward to retirement life, what we work for our entire lives for, right? And so she was excited about what was to come, what she was doing. She was independent, living at home. A community volunteer, very active in her church. She lived in her own home. I lived in mine. I was building a real estate business. So I was working way too many hours, trying to balance as much as I could. But she was living independently, as was I, in the same town, in our hometowns. But life was good. She was healthy. I was healthy. Things were good. And we were doing our own things in our own time, in our own ways.
So when she ended up in the hospital with a brain injury, and what was that like for you as the child to have to step in?
Number one, it was terrifying. Number two, it was devastating. Um, Very confusing. So my mom is not just my mom. She is nurse mom. She was a nurse educator for 38 years before retiring. So she was the guru. Everything medical we went to her for. We depended on her to be there. She was the matriarch of the family, is the matriarch of the family. And so we depended a lot on mom, just like you do for any mother typically, right? And so she was mom, she was nurse mom, she's my best friend, and she was also a business partner. So, and she's been my rock my whole life.
Yeah.
So to see her in a compromised position, number one, to see her compromised, number two, to see her life threatened, number three, to not have, here we go, to not have my confidant and the knowledge base in our family to defer to. You know, we would go to her for everything medical. And I needed to ask her so many questions and she couldn't respond. And I needed her to tell me what to do next. And she couldn't. It was I felt very helpless.
Yeah.
She needed me badly and I didn't know what to do and I didn't know how to do it. But I knew I needed to.
Yeah. And that had to be so frustrating just to think if she could only talk right now, she would probably know exactly what to say to these doctors and nurses and social workers coming into the hospital room about how to help coordinate care. But
I can't tell you how many times I said, Mom, come on, I need you. Tell me. What do I need now? What do I need to do? What do we need to do next? It was tough.
because her speech was affected, right?
Oh, everything. Everything. Yeah. So from the time that we went to the ER as we realized that we needed help, from the time that we went to the ER in our rural community, our home hospital, and then were transferred to the big city hospital, it was we arrived at the big city hospital at about 6 a.m. on a Sunday morning, and by noon she was non-responsive.
Mm.
So she was as much a mystery to me as she was to the doctors because I couldn't ask, what have you done? Where have you been? What have you taken? You know, all of those things. A big question that was asked of me was consistently, has she had dental work recently?
Mm.
I didn't know what dental work had to do with a brain issue. So I was learning things fast, but I didn't know. I couldn't connect the dots. I didn't know what medication she was on. I didn't know where she had been, what she had eaten. I had no idea.
Yeah. So learning to keep track of those things from the time she was in the hospital was a total change. It's kind of like taking on a parenting role, whereas before she was the parent.
Right.
Right.
taking on a parent role as in survival mode
Mm,
too.
yeah.
So it amplifies it that much
When
more.
you're afraid.
Uh-huh. Well, and mom's life depended on it.
Yeah,
If we made the wrong decision or if I said something wrong or interpreted something incorrectly, the result could be devastating.
definitely.
Mhm.
So she was, first of all, she was lucky to have you. And I'm so glad she's doing so well now.
Thank you.
So,
Spoiler alert.
spoiler alert. um, so we're a couple years, or is it 18 months? How long has it been since
Since
her brain injury?
we just celebrated 6 years.
6 years. Okay. So
6
it's been quite a
years.
while. That's
Yes,
great.
it has been.
She's doing really well.
Mhm.
But I want to tap into the knowledge that you have come to be sharing with the community as far as what you wish you had known going into it.
Mhm.
So I think one of the first things you like to talk about is the criteria for discharging to an inpatient rehab facility.
Right.
And we're not talking about going to a nursing home. We're talking about an inpatient facility where the priority is strengthening and rehabilitation in order to go home. So, what did you learn about the difference between subacute and acute rehab?
So acute rehab, I was asking regularly for rehab in a hospital setting, because I had remembered that from my grandfather's stroke
Mm,
years ago when he needed rehab. I didn't know that it was called acute rehab. Um, so I was asking for the right thing, but not asking it in the correct term. So I wanted mom in a hospital setting to continue with the oversight and strengthen and get home as safely and as well as we possibly could. And that criteria, um, it requires that a patient can withstand 3 hours of intense therapy. That's the terminology, 3 hours of intense therapy, which is intimidating to a lot of people. And that's, I'm going to call it global, right? Community wide within the medical community as well as on the patient side. When you think about 3 hours of intense therapy, when I tried to visualize that, and I asked several times, does this mean that mom's going to be running on a treadmill for
like
three
a
hours?
stress test or
Right.
something? Yeah.
Right. So intense therapy is subjective, um, and it is customized to the patient based on where they were prior to their major medical event, where they're hoping to go, the recovery that they would like to realize, and what is the event. So, in the case of a stroke or a brain injury, anybody who goes through a major surgery, you're depleted, you're wiped out, you're weak. Who can think about being on their feet for 3 hours in a day's time? Some of us who are healthy and active can't do 3 hours of intense therapy in a day's time. But what I came to learn and was pleased to find out is that 3 hours of intense, of course, is broken up throughout the day,
Mm,
which makes a whole lot of sense because somebody coming away from a major medical event does not have the energy or the stamina to withstand 3 full hours. Um, and it requires two disciplines of the three types of therapy. So there's physical, occupational, and speech. So if they need two disciplines, that is one check mark and a positive in the bucket for acute rehab admission. They do need to withstand it, which is difficult to prove in the hospital because it's very fast paced. We're trying to get patients home as quickly as we possibly can anymore for a variety of reasons, and they are just wiped out. And they're sick. Who
mhm.
wants to get up and be active for 3 hours in a day's time when you're sick?
Right.
So, realizing that a lot of those activities are just getting the person back to the level of health and fitness and activity
Independence.
independence. Thank you
Mhm.
prior to the event includes activities of daily living, which is brushing your teeth, eating, speaking, cognitive thinking. So, speech therapy, I always thought it was talking. And if somebody needed help speaking again or learning how to talk again, that's when they would have the speech therapy.
Which
But
is true.
it is true, but it's so much more than that.
Mm,
And it dives deep into the cognitive ability.
mhm,
And there's a variety of ways that they can work with regaining those abilities
mhm.
that doesn't require physical effort.
Mhm.
So a lot of exertion.
Mhm.
So it is therapy. And yes, it's intense because you're working the brain and you are working the body, but you're not physically, it's not cardio.
Mhm.
You're not
Yeah.
sweating. You're not having to balance. You're not having to be on your feet. So that was one of the big things. Bathing, dressing,
Mhm.
all of those things are part of the therapies that are paid attention to in both acute and subacute, but acute requires 3 hours or more in a day's time, whereas subacute is less than 3 hours. And there's a tremendous difference between that cutoff and the approach to therapy and getting a person back to their normal lives.
So, what is the difference if you come up to like 2 hours and 59 minutes of therapy versus 3 hours and 2 minutes of therapy? Is it really that close of a race to differentiate, or what did you find out when your mom went to subacute rehab?
That was exactly my thinking. What's the difference? So if it's up to 3 hours versus 3 hours or more, but minimally three, is there really going to be that much difference? And the answer is yes. So I assumed that when we went to subacute therapy, when we experienced subacute therapy, that we would be pushing the envelope up to 3 hours, as close to three as we could. Because again, we had a job to do. We needed to get home. We needed to do it quickly. We needed to get there, get it done, get home, and resume our lives. And in reality, on some days, one day, we got mom ready, which was a task, got her ready, got her dressed, got her um, situated for therapy to be prepared when they came to get her, and assuming that we were going to have several disciplines throughout the day. And she had 17 minutes of therapy in that day. So it actually took us longer to get her ready for the therapy that she was scheduled for on that particular day. And the reality of it is, when you're strengthening, you need to be working. You need to be exerting. You need to be trying. You need to be pushed. You need to be encouraged. You need to be motivated.
And really be participating in those therapies, not having them done to you passively.
Absolutely. And that's a large measure. Are you participating? As you participate and as you can show that you are improving, that's your path to stay longer.
Mhm.
And it's based on your participation and your improvement. And there's a lot of criteria, of course, for admission and then for continuation in therapy. Um, but all of that is a major piece. And if you're falling into depression because you're isolated, you're not active, you're realizing that you can't do the things that you did just a couple weeks ago prior to the major medical event, those are all they're negatives that are hard to overcome. So getting staying active and moving from a room to an area where there are people, where you can see people improving, you're motivated, you're encouraged just by watching others. That was a huge piece for us.
Yeah. And once you were able to get through subacute rehab and acute rehab at different stages, you also got to experience different versions of outpatient therapy as well.
We did. We
So,
did.
what did you learn about the difference between outpatient therapy that has specialization in neurology fields and neuroscience versus the kind of physical therapy you might have after a leg injury?
So that was huge because mom's event was a brain injury. Her brain was broken, and that's what happens with stroke too.
Hmm.
Your brain is broken for a period of time, just like a leg is broken, and you can heal it, but you have to go through the proper channels in order to heal and then recover, rehabilitate it. Same is true for a brain. So we spent an incredible amount of time in various therapies at various facilities where, as you talked about, the passive therapy, mom's arms would be moved, her legs would be moved. But when she couldn't move them on her own, we couldn't figure out how to make that happen. She had the ability. She could move. It was proven because people were doing that for her.
It's not like they had become stuck that way.
Correct.
Yeah.
Now she had lost the use of her left side. She lost the complete use of her left side going into the manifestation of this infection.
Mhm.
It presented very stroke-like, and I thought she was having a stroke. So she had lost the entire use of the left side, but it was evident that she could get it back as
Mhm.
that motion was proven.
Mhm.
But for her to command her brain to move her limbs wasn't always as easy as we expected it to be. She had just proven she could do it, but now when it was time for her to take over, there was a miss.
Mhm.
And we had to connect those dots between the brain and the appendages, the limbs. And so we spent a lot of time just in standard therapies, getting the right kind of therapy, physical, occupational, and speech. But when we found Cressman, that was a life-changing experience.
And what was so different when you went there in the approach?
They are neurologically trained. They put all of the pieces of the puzzle together. It is a whole body experience, starting with the brain, that is, in reality, the first piece of the puzzle that needs rehabbed. It's our control center.
Mhm.
So if our brain is broken, it's just like the engine of a car. If the engine isn't functioning properly, you can't run your car. You
Yeah.
can't drive it. If your brain isn't working properly, the rest of your body is not going to follow. But when you pay attention to your brain and the connection, and then the neuroplasticity, that was fascinating to
Yeah.
learn about. So the fact that our brain can compensate for areas that are damaged, sometimes non recoverable. But over time, with continued work, with continued therapies, with continued practice and strengthening, in most instances, in a lot of instances, it can be recovered. But in the meantime, it's smart enough, and we were brilliantly created
Mhm.
so that we can compensate. The brain will find different pathways, and it will learn to use those pathways to operate the rest of the body. And that's what those therapists knew. So the short amount of time that we were in that therapy, um, gosh, I wish we had found it so much earlier in our journey. I can't imagine the time that we could have shaved off by getting her to that level of therapy. And the fact that it was right here,
Yeah.
so close to home,
Right.
and so close to where we did a lot of our therapies and a lot of our recovery. Number one, it was exciting.
Mhm. Yeah.
But to know that we've got that level of expertise and it made that much difference was truly incredible.
Well, I always love to hear stories coming out of Cressman
Ugh,
because they really do work wonders. And the thing is, we don't want it to be limited to what she's talking about at Cressman Rehab. Is we have neurologically specialized physical therapists, occupational speech therapists, like they're highly specialized, but we don't want it to just stay there. We do have a couple other locations that also have those specialists. And then Norton Healthcare has partnered with the local university Bellarmine
mm,
that trains physical therapists to offer the nation's first accredited fellowship in neurologic physical therapy. It's called the Neurologic Movement Disorders Physical Therapy Fellowship, and I will include information about it in the show notes. We want any physical therapist who wants this neuro specialty to be able to participate in it from the community and be able to offer that level of care wherever they're providing it. So, if that's something that interests you, feel free to look into that and feel free to level that up in your community.
I am so excited about that.
Mhm.
It is certainly a need.
Yes, definitely. Well, we all have brains,
We all
and
we
they
all
are
need
connected.
brains.
Yeah, they're connected to every other part of our bodies. So, yes,
I like my brain, I appreciate my brain, and I want it to function well for as long as I can. That's fantastic.
exactly. So, the next thing we wanted to make sure to cover is what you wish you had in place going into a hospitalization for your parent as far as an emergency plan.
Mhm.
So, in an ideal world, what would you recommend someone have prepared?
So when you think about emergency, typically, I think back to when I was in school, in elementary school, and all of the drills that we did. You do fire drills, you do tornado drills, in some places you do, how to handle floods, and we are taught how to respond to those emergencies. Um, in some instances, we'll experience those, and in others, we won't. But I have come to realize that, uh, and it's crazy that it took this event for me to realize this, but we all will experience something major health-wise in our lives. It's not a matter of if, it's a matter of when. And I was thinking about this morning. It doesn't seem like we have as many sudden deaths as we used to. And I don't know. I'm not in the hospital every day, and I know that it happens a lot, but I don't seem to hear about that anymore. That somebody had a heart attack and passed away instantly. It seems like there's typically a recovery period. There's different levels of recovery, of course, and success and getting home. But preparing for that time when this happens, there definitely needs to be an emergency plan. And if you wait until the time that it's needed, just like a tornado, just like a flood, if you don't know where you're going to go, how you're going to escape, how you're going to get back to safety, or what you knew prior to, you're probably not going to be terribly successful. So, as we were in the throes of this emergency that extended over a long period of time, just in terms of her recovery and finding the right avenues to get her home and independent again, so many things we had overlooked. Number one, as I shared with you earlier, she was a mystery to me. So, as she was as much of a mystery to me as she was to the doctors, a John Doe coming through the doors because she couldn't speak for herself. I had no idea what her medications were. When they asked what she takes on a regular basis, I couldn't answer it. I knew where to find a medication list, but I didn't know if it was updated.
Mhm.
I could go to her area in her home where she had all of her medications and all of her supplements, but what is she taking? Just because it's there on the counter didn't mean that she's taking every one of those every day.
Yeah.
It also didn't mean that if I picked up that bottle and looked at the instructions how to take that medication, was she still taking it that way? Things change
Yeah.
as you're in treatment. So I had no idea how to answer questions to help her as efficiently and expediently as possible. So that's one of the big things is to, as much as a person is comfortable, some people are very private about their
Right.
health, and
And
that's
that's one thing I was
understandable.
about to ask is like, what if someone is very private about their own health information? How would you encourage um, a child to have that conversation with their parent to learn more about where they're at with their health and what's involved in their daily life?
That's a great question. I think the best way to have that conversation would be to find out, just ask very directly, how do you want things to go? If you are in a situation where you need me to advocate for you, what do you want the outcome to be? And that's probably the starting point because that paints the picture. So if somebody wants to be a DNR, if they go into an emergency situation and they're ready to be done and they're ready to be called home, whatever that looks like for them, um, then you need to know that.
Mm.
And if they want every possible opportunity presented to them and take advantage of every possibility available, then you need to know what that looks like and how to get there. So if a person is private about their health, again, very it's respectable.
Hmm.
And that's not anybody having that conversation does need to respect that about their loved one, about the person that they're intending to advocate for. However, the advocacy cannot happen effectively without information. So, my suggestion would be if someone wants to remain private, okay, but find a way to allow that information to the advocate at the time that it's needed. So, if that means writing down your medication lists, updating it, remembering to update it from time
Hmm.
to time, that's something that's
When
out of
something
sight, out of mind.
changes.
Right.
Yeah.
So, that needs to be an active task. Updating the medication list, updating desires, any information that they feel like a person should know in the event that they are incapacitated and they can't speak for themselves. Have it somewhere accessible. If it's a lockbox, if it's a whatever the safe place is, whatever you choose, have the instructions available to that person that they can access it. I don't really know how else to do that because you can't pry something out of someone
Right.
without it becoming sometimes adversarial.
Yeah, and that's not what we're talking about at all. We just want to make
No.
sure that if you have someone in your life who would have your best interest at heart. And if you are unable to speak for yourself, who can speak for you? Who would you want that person to be? Let them know that they're your person, and
Yes,
then write that down somewhere. There are healthcare surrogate forms. There are living wills that can be filled out that can clarify a lot of that. And that can be really helpful in the event you have several children, for example. Like
mhm,
we were talking about, if you have 10 children and none of them are necessarily designated to be the communication hub, then
mhm,
it can get really confusing. And so it's good to have a designated person to kind of centralize the information and help people stay organized and
certainly,
when trying to navigate the health system and a health condition,
absolutely, yes.
which is an ongoing process.
Mhm. There were several times throughout our journey that, in talking with families, sitting down with families, assumptions were made within those families that a certain person would be the one to step up, or in the event that someone had several children,
Mhm.
they expected that there would be somebody there that would be their advocate and would advocate strongly for them, and that's not always the case.
That
So,
person might be expecting someone else to do it if
right,
it's not discussed, right?
right.
So it's
So
just good to have an open conversation about what you expect because we can't read each other's minds.
absolutely. And that's part of the emergency plan is knowing who serves what role and what they're to do at the time that they get that phone call and stay in their lane. So, the knee jerk reaction when something is happening to someone that we care about is everybody floods to that spot. And then now sometimes there's too many people and sometimes it creates chaos. And sometimes that confusion can get in the way of the optimal recovery.
Yeah.
So, getting those roles defined prior to the time that it's needed is huge, and then knowing what your expectation is, and then stepping up and saying, "I'm not in a position to fulfill that right now
Yeah.
because this is happening in my life, so I need somebody to quarterback me.
Hmm.
I need someone to come in and help me, and then in turn, I will help them later," but know what the support system is and what that looks like.
Definitely.
Mhm.
I love this because I've definitely seen it make a huge difference whether or not it's in place for families. So thank you for describing that from your own experience, especially.
Certainly.
Um, Another thing that I know we wanted to discuss today was the importance of being present
Mm.
in when someone is in the hospital or having a therapy treatment. Tell me about how you've seen it be so important for you to be physically present for those type of interactions.
Right. So with my mom's situation, I had to be there. There was no choice because she could not speak for herself. So I needed to see what was happening. I needed to know what the progression was. I needed to be there to be her voice, and to get to the next step in the process. So, what I saw very quickly is that it's important to not only be there, be present, as you said, meaning be available for the professionals that are walking in the room, all levels, social work, physicians, nurses, CNAs, everybody that has a piece in the puzzle to getting your loved one well. In my situation, the second that I left, that's when they would come in.
Hmm.
It's kinda like Murphy's Law in a hospital. So, if I stepped out for a second, generally, I would miss the person that I needed to speak with or who needed information from me. So, I learned to stay put, and then, it would be nice to have somebody that would relieve the person that is there and is the advocate for the individual that's struggling, who's ill. Um, so that was one of my big things was to stay, be present, observe what was happening with mom. I started taking notes, a lot of notes, because these terms were not familiar to me.
Hmm.
And so I was learning a lot very quickly. So I was note taking, I was trying to recall, I was trying to learn what would be expected of me, what I would be expected to share. So being there and seeing what was happening with medications, the times that they were given, how they were given. Now my mom wasn't eating, of course, so food and water, taking it with a meal or with with a full glass of water, that wasn't anything for her, but it is for a lot of people. Um, but being able to see what was happening with her so that I could then report to the next person. You've got a lot of shift changes, you've got a lot of moving parts, you've got a lot of different specialists, you've got a lot of consultations that are happening, and being able to answer those questions knowledgeably rather than guessing was I think it made a tremendous difference for my mom. So I feel like that is absolutely essential. So having and that's part of the emergency plan.
Yeah.
Who's going to be there on what days, during what shifts? What is your area of expertise? What are you willing to do? What are you not comfortable doing? Putting all of those pieces of the puzzle in place prior to needing it is absolutely essential.
And I've noticed it's been very helpful when family members come to like physical therapy or speech therapy or occupational therapy appointments as well, because
Right.
a lot of what's happening there is you're learning what type of exercises need to be done at home, but you're not going to be inpatient doing it. You're going to have to be
Right.
doing it at home. And so having someone else there to learn, to be
Hmm.
able to support that to happen at home in
Certainly.
between sessions has also been huge. Is that your experience too?
For sure. Seeing their ability, their level of ability, because there's a picture of this person before things happened, and then there's the event, and there's the recovery, and then there's the picture of what you want things to be like following, which is typically what this looked like at the very beginning. And there's quite a process going from A to Z and then back to A. So, in order to best support your loved one, knowing what they're willing to do, knowing what they're able to do, knowing what you have observed, how to properly and safely move,
Mhm,
transport,
mhm.
feed, all of the things that you now are doing that you never expected to do. There are certain ways to do it safely. And if we're not educated, it's quite honestly dangerous. It can be dangerous in certain circumstances. So, being present, watching what was happening, being able to celebrate, that was a big thing for mom and I.
Yeah,
When you are in a situation where you've been fully independent and then now suddenly you're so incredibly compromised, I can't imagine how frustrating that is to try to relearn abilities. And then if you don't have anybody to celebrate your successes,
right?
I mean, that's such a big thing. A lot of us have had weight loss journeys in life, and just that 1 pound loss,
Mhm.
but having someone to celebrate you, it feels like you've just lost 10 pounds.
Right?
And that's the case with recovery and therapy. If there's not anybody there to celebrate it and see the small victories, that's what propels someone. That's the motivation.
Mhm,
That they can see that they are successful, they are victorious, that the small step matters to
mhm.
getting to the big step. And so those celebrations were big, and
Oh,
being
yeah.
present in that regard was huge.
That's a good point. We need to share our joy to multiply it, don't we?
That's right. That's right. And it
Well,
was fun and it was exciting and it was memorable.
that is amazing, and your mom is so lucky to have you and your
I'm
help,
lucky to have
and
her.
yes, and then now the community is so lucky to have you helping to share this wisdom with them as well.
Thank you.
So thank you for sharing what you've learned and where you guys are at in your journey. And I hope you will tune in to the next episode as well of the Stronger After Stroke podcast to learn how you too can be stronger after stroke.